Nerette, and
Hello.
we have another topic for the day. Today we're going to be talking a little bit about nutrition and supplements. So I know there's been a lot of news articles lately about how supplements are a waste of money and we shouldn't be taking them. So why are vitamins and supplements important to take and not a waste of money?
I know. And that's a very important question. We hear that every single day. There've been a lot of news, let's say, about why you should not take vitamins and minerals, the waste of money, there's a lot of side effects. In a way, they're right. If you take the wrong vitamins from the right source, it is going to make you sick. But you have to remember, a lot of people, the companies that actually write these articles are pharmaceutical companies, so they have their own agenda. Really, in functional medicine, we try to fix the underlying root of the problem, and by doing that is, I want to fix each cell. And if you guys remember about the mitochondria that we learned in school, the powerhouse of the cell, which makes what? ATP. ATP is energy, muscle, weight loss, anti-anxiety, sleeping. That's very, very important to prevent the aging process. So what's required to make the mitochondria work? Vitamins and minerals, zinc, selenium, magnesium, CoQ10, all those are important elements that's required to make ATP, and with age we have less and less and less, and in a way when you age you kind of implode, you become shorter, you're lacking a lot of stuff, and that's one of the reasons functional medicine is also called anti-aging. I want to slowly prevent the aging process and at the same time prevent age-related diseases. So long answer, but vitamins and minerals are crucial in the wellness of every human being.
So why can't we get the supplements from the foods that we eat directly? Why do we have to physically take the supplements and vitamins?
And that has to do with the quality of the food. That most of you know, now even if we eat organic food, we only receive about 50% of the nutritional value. 50%. So that's number one. Number two, we're still very, very stressed. You know, as we age, we thought before we have less stress. Now everyone's working 50, 60, 70 years of age with a very high amount of stress, which basically means it consumes more of the vitamins and minerals. So between the lack of nutrition in the food and our daily busy lives, we need much more vitamins and minerals. And again, to be able to help make this machinery called our body work optimally.
Okay. What are some disorders from vitamin deficiencies that you know?
Well, there are a lot of, and still I get surprised of what we fix with just simple vitamins and minerals, from anxiety to depression to insomnia, skin changes, hair loss, hair thinning in the woman, weight gain, weight loss, bone disorders. They all have to do with the lack of vitamins and minerals. Remember, it also helps to make more of the hormones. So you need the right vitamins and minerals to make the estrogen, testosterone, progesterone, but also make the hormones in your brain, serotonin, epi, norepi. So it is very, very crucial. So I would say there's tons and tons of medical conditions that's associated either directly or indirectly with vitamins and minerals.
Are they FDA approved, the supplements?
They are not FDA approved, and that's one of the reasons getting supplements from a medical grade, which is critical. Medical grade means that we actually interviewed medical companies that make these supplements for us, and they do not only testing themselves for the quality, but also they have third-party companies to doing their own testing, and most of the supplements from the big chains do not do that, and hence that's why you can't get sick or the quality is not there.
Yeah, wasn't there a recent study in New York about the differences from supplements from these big brands and pharmacies versus medical grade supplements?
Yes, it was actually about 10 years ago. We've done this for a while. When you talk about medical grade, it comes from a medical company. It means that the bioavailability, which is very important, it means the absorption. So if I'm going to put 100 milligrams of, let's say, vitamin C, I want you to absorb 95 milligrams, but at the same time, if you get over-the-counter supplements, you might only absorb 5 milligrams, and the quality is second to none. But the study that you're referring to in New York about 10 years ago, when they compared medical grade versus all the other over-the-counter that most people see, when they look, for example, at omega-3, 100 milligrams, you know how much actually they had inside the capsules? Most of them had zero amount of the product. They actually put rice powders. So if you are taking your vitamins that's not medical grade and you get gassing or cramping after you take the supplements, there's nothing wrong with your stomach. There's something wrong with the supplements. Hence why try to choose medical grade supplements.
Okay. What age do we start taking supplements?
Well, I think everyone is different, but I start in pediatrics on. I think we have great success, for example, treating kids for attention deficit disorder. Attention deficit disorder is a lack of certain vitamins and minerals, and sometimes it's too much of the wrong vitamins, minerals, or the wrong foods. Now we believe when my patients do get pregnant, I make sure that they are on certain vitamins and minerals in order for the absorption to go to the placenta and therefore to the fetus. So really there's no really age criteria. Functional medicine is personalized medicine, so I will personalize a plan depending on what the patient has.
Okay, so essentially you're saying it's very important to see a doctor and clinician before taking supplements. Why is that?
Absolutely, because there's a lot of things out there. Let me give you an example. If you look at brown eggs versus our medical grade vitamin, this one, even though it says 200 milligrams, you have no idea how much milligrams it actually has because it is not, FDA supplements, and you don't know who's actually testing this. When you look at medical grade supplements, and this one, for example, Phyto Plus, which is a vitamin that is plant-based, you could guarantee that the number of milligrams in each capsule is correct. Even though it might take you 2 months to take the last pill, you are still going to get the minimum amount of milligrams. And again, as I said, it actually will also, the absorption will be almost 100% with the medical grade supplement.
So when we take the supplements, is there anything that the patient needs to do or we do to make sure they're getting the appropriate level for them?
I mean, a lot of times, some of the blood works that we do, very specialized blood work, it tells me directly or indirectly what kind of vitamins and minerals that you possibly have. Again, like everything else in medicine, taking too much of something could be hurtful to you, or taking too little can also cause side effects and be helpful. So for us in functional medicine, all these vitamins and minerals, they are a prescription. We fix people with connective tissue disorders, diabetes, hypertension, cholesterol, migraines with these natural supplements. Since this is a personalized medicine, it's different for everyone. If you are going over the counter and getting a supplement and just taking what's on the back directions, it's normally the wrong dosage for you. And then you also have to know, do you take this with food, without food, in the morning, at night, and with what other supplements would that benefit you? So it's not as easy as just buying the supplements, because I think a lot of people waste a lot of money and actually can do a lot of harm taking the wrong supplements.
Well, thank you, Dr. Nerette, for answering all our questions about supplements and informing us. Please visit our website, bellissimomedical.com.
Thank you so much.